Because he's very handsome. Dr. Irwin Redlenner joins us now. MSNBC medical expert. Dr. Irwin Redlenner.
Here he became Dr. Doom.
Dr. Irwin Redlenner is the founding director of the National Center for Disaster Preparedness and senior research scholar.
Dr. Doom.
Live from Ukraine. Hello. Hi, doctor. Oh, hello. Uh-oh.
Hey, Stephanie.
There he
How
is.
are you?
I'm good. I'm good. Live from Ukraine, as I said, you tweeted, who's making sure that Ukrainian refugee kids are getting needed support, including essential educational continuity? Random acts of kindness and model programs are not enough. The war is an ongoing nightmare, but education failure is a future time bomb. So there you are, over there doing what you can. Again, this is how many trips is this to Ukraine for you?
4 or 5.
Yeah.
I think something like that. 4, at least. Yeah.
Yeah. God bless you.
Hey.
Go ahead.
No, I was just going to say it's we keep coming back here because we really want to make sure that the money we're using to support programs and people is going exactly where it needs to go. And I just got out of an event where Karen and I were here and we gave out like 100 more, because we've done this before, computer tablets to internally displaced children who have to learn remotely and don't really have the technology to do so. And we saw it in action. We were able to physically hand these tablets to the children who are going to be using them, which is a great feeling.
Wow, I was going to say that must be a gratifying look on their face when they get
Incredible.
That tablet.
They're beautiful. They're adorable and appreciative.
Yeah.
And it's happy to be doing this.
Speaking of your very, very long title as a founder of the Center for Disaster Preparedness, you also we haven't talked a lot about the this horrible. You said earthquakes in Turkey and Syria. Yeah. It's a catastrophe that needs massive international assistance. Not so easy to secure in today's world of conflict. Reminds me of the horror of the 2010 quake in Haiti. Rescuers have 72 hours to get the survivors in rubble before deaths skyrocket. Yeah, I mean, those numbers are just heartbreaking.
Yeah.
Yeah.
It's a horrendous situation. Haiti obviously had its own problems, extremely bad infrastructure and bad government, and a lot of people crushed and not enough heavy equipment to get people out. And it was tough getting into the airports. And Hillary Clinton, when she was Secretary of State, really had to kick through some doors to make sure that supply airplanes could actually get through and land. Yeah. It was pretty amazing.
Yeah.
But it was also warm weather. Here we have this 200 kilometers of earthquakes and aftershocks, and it's absolutely horrendously cold. So for many people, the problems begin even once they get pulled out of the rubble, because it's freezing. They've been under tremendous stress. They have crush injuries and chronic medical conditions, and they're freezing cold.
Yeah. Doc, I wanted to talk to you about, there was a piece that just struck me this morning in Huffington Post. It just is entitled, "If you're thinking COVID is over, here's what I wish you knew." For most people, COVID is effectively over, but this is not so for the 2.7% of Americans, approximately 7 million people who are immune compromised. And she writes sort of a heartbreaking piece. She just says, every social interaction involves a calculation. What's the current transmission, the positivity rate, the vaccination status of the people we'll be with? Recent evidence shows the unvaccinated are more likely to spread the newer variants. That I had not heard, but yet another reason to get the vaccine, if not for yourself, for other people. Yeah.
Right. And there's also some new variants that are potentially a problem also. We don't know enough about them to know whether they're going to be more effective or more resistant to vaccines. But the answer to every single thing that you bring up is get yourself vaccinated.
Yeah.
And there's still, an army of vaccine resistors, and they promote misinformation on social media. And I think, I don't mean to be overly pessimistic, Steph, but I don't see how we're going to break through. I don't know what we're going to do about misinformation on social media. It's something I've been thinking about a while, and it affects everything, including people's abilities to not be stupid.
But that's what I mean. That people's selfishness and stupidity will continue to impact us as a society is just endlessly infuriating to me. She writes in this piece, a family member chastised me, told me I'm living in fear, and I need to think positively. She lists her whole. She's very immune compromised. She said, "You're overreacting." Another said to me, "COVID's no more than the flu." She said COVID deaths continue to far outpace deaths from the flu, and a disproportionate number of the dying are immune compromised. We just played a soundbite talking about Ron DeSantis, but she lives in Florida. So she said, the isolation and the precautions sting, but the result of the last year's election also hurts. Governor Ron DeSantis promotes quote-unquote freedom over vaccination and masks, among other questionable policies. He passed numerous laws prohibiting vaccine and mask mandates and promised to keep Florida quote-unquote free. Voters elected him in a landslide and seemingly no recognition that freedom for the masses is in effect stolen from the immune compromised. I can't even get accurate data about current COVID levels in the state to calculate the risks of shopping or socializing. That's another great point of COVID deniers and science deniers like Ron DeSantis, right?
Right. And since the day I met you, we've been talking about the politicization of this public health question. And, a combination of really, really bad information that's being promulgated on the web and by politicians. But we also have this health problem, this medical problem that's become a political football. It's like a badge of honor to be a vaccine denier and a science denier.
Yeah.
If you're a MAGA guy. And it's just pretty sad.
Yeah. I have to just read her closing. She says, part of my coping strategy is writing this essay to ask people to remember the millions of us who remain vulnerable. Excuse me. Please call or FaceTime if you're vaxxed and willing to test. Find a way to visit us outside. If it's too cold, start planning for a visit in the spring or summer. Perhaps you'll even mask again for our sakes. When the numbers are high, please just don't forget us. We were struck by the fact that only Bernie Sanders wore a mask during the State of the Union.
Yeah.
Excuse me. Sorry. Coughing up a lung, not COVID. But yeah, I mean, I guess, you're right. It's just sort of depressing. You sent us a piece about just, doctors and the healthcare workers being burned out that, we've sort of forgotten after COVID.
Yeah.
It's a piece a doctor wrote saying doctors aren't burned out from overwork. We're demoralized by our health system. And you were, you sort of harken back to your experience with the Clintons. You said this trend went into high gear when organized medicine aggressively opposed healthcare reform in '93 when the Clintons tried to create change that would have mattered. You were on Hillary's task force in the White House for a year, and you say you were mortified at the self-serving, intense positions of organized medicine and raw political power they applied to put down reform. Now what? Well, that's the question of the hour, right? I mean, we seem like we're no closer to universal health care.
Yeah. So, from the very beginning, we should not have had healthcare become a business. And it's a profound problem that has affected everything, and including, as reported in this article, people, myself included, think that the bad healthcare system and bad access to healthcare was one of the things that was responsible for an excess amount of fatalities from COVID. People couldn't get the care they needed when they needed it, and that's been just a kind of a layered on disaster. But the problem, when I was in the White House for a year in '93, working on Hillary's task force, we thought we had a really great plan to make healthcare affordable and fair and everything else. And the AMA, organized medicine, were fierce opponents of doing the right thing. So doctors lost control of it. It's literally a big business. I don't care what major medical center you go to. And I only know of one in the country, which is the Montefiore Medical Center in the Bronx, that has a different philosophy about how healthcare should be organized and how there should be zero barriers to people who need healthcare. They should get it because they have healthcare needs.
Yeah.
Not because they have money or don't have money or their insurance is expired, or insurance limits them. It's really, I hate to say this, but it's in many ways embarrassing to be part of the healthcare system now, and it is causing a lot of people to leave it. It's just It's pathetic.
Yeah, this article points out we're, of course, the only large high-income nation that does not provide universal health care. It leads to tens of thousands of preventable deaths because healthcare is so expensive. And he further points out during COVID, the consequences have intensified. One study estimates 338,000 COVID deaths in the United States could have been prevented by universal health care. And you just talk about, I think it's in 2021 alone, 117,000 physicians have left the workforce, which has already worsened a chronic physician shortage, right?
Totally worsened it, and even even before they actually quit the system, they are so constrained in the healthcare system. They're so controlled by the bureaucrats and the accountants because the hospital system in general, its motive is making profits.
Yeah.
And if you take too long, if you don't, you don't fill out the right paperwork, if a whole myriad of issues come up that cost the hospital more because you're spending more time, that's a downer for the people that are minding the finances of the hospital. Big, huge profit-making organizations, sadly enough.
Yeah, it's insane. And quickly, the last thing I thought was interesting, he said, we sit at our patients' bedsides and counsel them on their duty to counter the risks of obesity, heart disease, and diabetes, for example, while largely ignoring how those diseases are tied to poor access to quality food because of economic inequities.
Yeah.
Yeah, I mean, it's systemic, like you say, right?
It's systemic. It's really bad, and it really will take the president leading the way to try to make sure that Americans get the kind of health care that we deserve and need, and we'll see what happens. It's a rough environment for anything right now, politically, but we're going to hope for the best.
Thank you. I was going to end with your tweet about guns because somebody tweeted, "Thank Christ I was born and raised in a country where our politicians don't wear AR-15 lapel pins."
Right.
And you just said, "I'm profoundly mortified again about this kind of behavior and dangerous stupidity of so many of our politicians. Hard to know what to say, really, particularly as a pediatrician, right? I mean, it's Go ahead.
It takes the piece apart every time there's a school shooting. It takes a piece out of your soul, really. It's just a horrifying reality. 400 million guns in America. We have more than enough for every single person, every baby, it's crazy.
I saw Fred Gutenberg.
You got to help us, Stephanie. You got to get us out of this.
Yeah, right. I saw our friend Fred Gutenberg on Nicole Wallace's show yesterday, and she said to him, "I think I cry every time I have you on," and I do too. I cry every time we have Fred Gutenberg on, and it's the 5-year anniversary of Parkland, and here we are. AR-15 lapel pins, like it's a badge of honor. Anyway, all right, Doc, stay safe over there. We miss you. We will talk to you next week.
Thank you.
All right.
Thank you.
We link to the Doc's good work.
See you guys.
That's right.
Bye-bye.
All right, bye, honey.
Bye.
20 minutes after the hour. This portion of the show brought to you by Bonnie and Clyde's Dino. Hi, Bob. Hi.